Do you know which book has been mentioned as the most helpful for recovery in the 155 recovery interviews I've conducted so far? If you've listened to even a few, you can probably guess what book that is. It's become such a phenomenon that there's even a term for it. Doctors call it book recoveries. You read a book, almost always this one specific book, and you recover. If you're new here, welcome. I'm Raelan, and don't worry, in this video, we're going to tell you what book that is. Each week here on the channel, we dive deep into new recovery journeys from chronic conditions like chronic fatigue syndrome and long-haul COVID, so we, as a community, can get inspired and learn from each other. This famous book I mentioned changed everything for my guest today, Dr. Doug Guiffrida from the University of Rochester. After years of seemingly random, unconnected health issues and unbearable back pain that he was told required surgery, the information in this book didn't just help him avoid surgery and fully heal, it also steered his career towards a whole new kind of research. He now trains doctors to implement the same recovery strategies that have been so effective for him and so many others. Doug, so great to have you here today. Thanks for doing this.
Yeah, thank you. Thank you for having me.
So you have had quite the journey with chronic pain and all of this. So tell us about that.
Yeah, sure. So like a lot of providers, I got into this because of my own chronic pain. I had back pain. I had a herniated disc with, showing on an MRI. Couldn't sit down for a year. I was in extreme pain and was going to get surgery. And while I waited for surgery, I found a book by a guy named John Sarno, who I think a lot of your readers or viewers are familiar with, and read the book, found a therapist to do some of the harder work, and my back pain was gone within a few months. Went back to all my activities, playing basketball, sports. And not only that, but a lot of the other health problems I had suffered with for years went away. I had arthritic knee. I had what nowadays would be called IBS. I think that was probably before that diagnosis existed. This was over 20 years ago. Shoulder pain, headaches, you name it. I had all kinds of stuff that, one would go away and the other would come back. I actually had heartburn so bad I had surgery for acid reflux, which I wish I had never had now because I clearly didn't need it. It causes problems for me now. But so everything went away. I didn't do much with it as a practitioner. I'm a counselor, but I didn't do chronic pain counseling. In fact, we didn't talk about it much with anyone because back then, you talk about it with people and they think you were nuts to say that something physical could be cured by something psychological. And so, I whisper to people in the shadows about, maybe you should try this book, but didn't do much with it. And then a few years ago, I took an administrative role at my university, and it was one that was very stressful. I wasn't enjoying it. And my back pain came back. And so I had a conversation with my supervisor at that point to say, look, I can't do this anymore. My back's hurting. It's clearly bothering me. And for a while, she had a hard time letting me out of the role. And finally, she said, okay, fine. If you don't want to do this, what do you want to do then? And I said, well, I want to do chronic pain counseling. And it wasn't my area. I had been studying how to keep kids in college. That was my college retention was my area. And she said, well, great. We have a medical center here. If you want to learn something new, you can find someone. I'll actually support you to do a fellowship. And so she supported me. I found a fellowship at the university with someone who does this work with people with seizures. A guy named Bill Watson, who's a psychologist who works in the Department of Neurology. He opened me up to the whole world of what we'll talk about later, which is ISTDP, emotion focused therapy. Bill uses this with seizure patients. About 40% of seizures are non-epileptic, meaning there's no chemical activity in the brain indicating any seizures. And they're what's called psychogenic seizures. And they use the same emotion-focused approach that I'll talk about to cure people of psychogenic seizures. So I studied with Bill. I got to learn from a guy named Howard Schubner, who some of your listeners are probably familiar with. Alan Abbas is another big person in this field, did a lot of my own work, learning it, engaging in it, did what's called core training in ISTDP, which is a pretty intensive 3-year training approach with a local expert named Marvin Scorman, and then opened my own private practice.
Wow. I'm just I'm still stuck on the point where they were telling you that you needed surgery because your chronic pain, back pain and leg pain had been quite severe. And
I couldn't sit down. I couldn't move. I would be locked up on the floor for sometimes hours at a time. I got out of my car once at work and dropped to the ground, couldn't get up for, a couple hours in the parking lot. I mean, it was severe. And, there was visual evidence to indicate there was a structural problem. Now, what we know now is that's all pretty much nonsense. My back looked the same before it hurt. It probably looks the same now. There's quite a bit of research supporting the fact that back, shoulders, knees change as we age. They look different, just like hair turns gray. Our backs get narrow, separate, show little cracks. That doesn't cause pain, just like gray hair doesn't hurt. It was a psychological problem. And, there's quite a bit of evidence now indicating that there's really very little relationship between observed structural changes in the back and pain. Almost everybody, you probably show herniated disc. Most people over the age of 30 show one of these things that would be diagnosable, but don't have pain.
Yeah, it's interesting, our understanding of chronic pain now, because we used to think not so long ago, well, if there's no structural damage, maybe this is a psychogenic thing. But now we're seeing that there's very little correlation between the level of structural damage and the pain that you're experiencing, or the pain being an indication of a level of structural damage. They just really aren't.
Yeah, doctors and radiologists can't tell from looking at images who has pain and who doesn't, which it should be pretty clear cut, but it's not.
So when you read Dr. John Sarno's book, what was it from the book that was resonating for you and making you think, okay, this might be what's happening for me?
Well, the symptoms, right? The fact that I had always had something, really since I was a kid, stomach problems, headaches, digestive problems, the sleep problems. It was always something. One would go away and the other one, so you just find this carousel of specialists that are just looking at one particular body part. That really resonated. The personality characteristics that I don't know if you're familiar with some of the things Sarno talked about, but they're so true for me and most of my clients that I see. Really highly motivated, ambitious, hardworking, but also really uncomfortable with strong emotions. We're the people that run around trying to make everyone feel better. We don't like it when people get upset. We can have a party and everybody has a great time, but if one person is unhappy, we're really upset about that. Those kinds of things really resonate.
I know a lot of people watching will be familiar with the book and have heard about it, but many won't have read it. So the approach to treating this, what does that look like from that perspective?
Well, Sarno said that, a lot of people can get better just by reading the book. And I know you mentioned in one of your interviews that you've had folks talk to you about that too. Just the idea that it resonates with it, that this isn't a structural problem, that there's nothing wrong with me physically, that I just have to get in touch with my emotions and learn to not be afraid of things and engage in things in a more gradual, but persistent way. That he said about 80% of his patients got better just doing that. I wasn't one of them. And a number of us, the people that I see usually are not. They have read it. They're familiar with it. That's why they find me. But they're still struggling. And so what we engage with now is a process called intensive short-term dynamic psychotherapy. I do some of the other things that I think your viewers are probably familiar with: brain reprocessing, pain neuroscience education. I think those are some of the buzzwords that, and I definitely use those tools. But for me, the core of the intervention is this emotion-focused approach. The idea is all emotions are healthy. We're born emotional human beings with this whole range of really intense feelings that need to be there for us to transition and deal with all life's issues. Even things that we consider negative emotions, grief, loss, intense anger and rage. Those things are all helpful to us to mobilize us, to advocate, or do things to help ourselves or others. But we learn early on, often from our caregivers, that some emotions are okay and healthy and good, and some emotions are really problematic and even dangerous. And so we develop strategies, sometimes even before we even can talk, to adapt to our environment, to protect ourselves and others from these emotions that we learn are not okay. So we are born the most helpless creatures on the planet, right? If you watch a horse born, they jump up and run away, right? Babies are completely helpless. Our human babies, our entire existence depends upon a bond between us and our caregiver. And so we learn to adapt ourselves to fit in that environment to get the care we need. Sometimes this can happen where, parents are ragers, angry, hateful, you see all this fighting. It can come because of abuse, but more often than not, it can come because really good parents just are really uncomfortable with the fits that a kid throws or the range of emotions that a kid might show. Probably a lot of people have seen the Disney movie Inside Out. It's just a beautiful depiction of really good parents who teach a kid that, where's my happy girl? And you can't be upset and put a smile on it and that kind of thing. And so we learn to disconnect from these emotions to fit with the needs of our environment. And we develop strategies to ward off these uncomfortable or dangerous emotions that we perceive. One of the strategies can be varied, but for chronic pain patients, it tends to be physical pain. Parents who might not be adept at handling their anger, their rage, their fits, become very mobilized when they have a stomach ache or a headache or hurt themselves. And we learn this. And so subconsciously, we're able to transform these physical or these emotions into physical form. There's actually quite a bit of MRI research that supports this process, which is really quite amazing that we're sort of supporting the things from the 1800s now. MRI research with people in chronic pain versus acute pain looks very, very different. Acute pain, which they'll put someone in an MRI, kind of apply heat to their finger in a way that doesn't harm the finger but hurts a lot. And you see the brain lights up. There's not one pain center like there is an emotional or a visual cortex or an auditory cortex. It sort of lights up all over across the brain. But you put people with back pain, for example, in an MRI, their brains light up at one little teeny place called the amygdala. And you might guess what the amygdala does if you're not familiar already. It's the part of us responsible for really intense emotions, anger, rage. It looks very different. So science is actually backing up the idea that emotions can be transformed into physical form.
And we know all this now, and we can have these conversations, but what's your experience? Because you said, back then you'd kind of whisper this in the shadows. What's your experience now with people knowing and understanding and accepting this?
Yeah, most of the folks that I work with come to me because they know and understand and accept this, but and some folks can work through the process very quickly. In ISTDP, we call those low resistance patients. They come in ready to go. All these defenses have been lowered. They understand what they need to do. They trust me. They trust the process. And you can just see this transformation pretty quickly. These are some of the more remarkable recovery stories you might see. We're able to work through the little bit of defenses, point them out. They notice them. We work together to kind of, work through them. And then these emotions can kind of come up. Other people, it's more complicated and it's harder. I was one of the people that's more complicated. I still am to this day. Very guarded and defended. I still am in therapy and I have a lot of challenges getting in a lot of the core issues and emotions. But I'll tell you a little bit more about what the process looks like, I guess, and what gets in the way. So we might start talking about something that's not a big deal but bothers. And in ISTDP, we're always checking in the body. What do you notice in your body as you talk about this person that you're angry with? Often our anger comes in the form of other people. And when we check into the body doesn't lie. The brain will lie. They'll say, I'm angry, I'm so mad, I can yell. But we check in the body, and often in the beginning, you'll see tension, not looseness, right? What do you notice? My stomach's tight. I feel constriction in my chest. I feel something tight in here. My shoulders feel tight. Those are the different places. Mm-hmm. And that's anxiety. They don't know they're anxious. It's a subconscious anxiety. What they're anxious about are these feelings that you're warding off. Tense rage, anger, and actually underneath all of that, guilt. And so once they get to notice that, they realize they're not really angry at all. They know they should be, but their bodies are really afraid about this feeling. And so, and usually the pain will start up. Oh, like in groups, it's really quite funny to watch when I run groups. Someone will get activated, and you'll see the other people in the group. Oh my God, my back, this chair, I have to stand up or adjust, or they just get activated by other people's emotion. And so we teach them that. They might have to get up and go to the bathroom. People with IBS, I drink a lot of coffee, I got to go to the bathroom. That's a way to ward off the feelings. Another way is what we call cognitive disruption. They lose their train of thought. Happens all the time when we get on something big. What were we just talking about? What did you ask? I can't remember what you said. That's a defense. And so we'll point these out. Intellectualization, I need to just forgive them. She had a hard life. We get there. ISTDP gets to tremendous forgiveness, but you can't short-circuit it with defensive behaviors. So once they are able to work through those, the somatic experience of anger and rage is often allowed to come through. And that's very different. It's a looseness. It's a heat. It's a warmth. It wants to move and push up and out of the person. We'll see them sighing. That's an activation. We'll notice hands moving, clenching, sometimes grabbing. We watch the leg movement. When you see activation and they talk about a warm, loose feeling, that's the somatic experience of rage mobilizing, and it will come out. And sometimes we'll ask them, they'll have visions, quick images. I have this, pictured person, and sometimes it's not even the person they're starting to talk about. It can quickly go to primary caregivers or people who've abused them. It's called an unlocking when it comes out in its fullest form. It is the most dramatic part of the healing process. It doesn't happen in all cases, but when it does, it usually leads to some pretty dramatic improvements.
What sorts of conditions or symptoms are people coming in to address with this?
Back pain, knee pain, shoulder pain, headaches, fibromyalgia. So I didn't get into this. I got in it more for those kinds of issues. My first two clients I saw both had fibromyalgia. I didn't know much about it at the time. This is going back about 10 years. But I had read some of Schubner and Lumley's work that they had used these effectively, so I started using it with them with an understanding to say, hey, you're the first people I've seen with this. I can't really promise, what will happen. I just know that other people have used it. And they both got better very, very quickly. In fact, went back to their doctors and told them they were cured. And the doctor called me to say, what happened? How did this happen? And as you can imagine, after that, my practice really picked up pretty quickly. So I have been working more with folks with fibromyalgia. I take them readily because I do believe that it's the only thing that I've learned that really can cure it. At least, keep in mind, the people I see have been through everything else. I'm never the first stop. I'm usually the last. So they'll come with all these other things that they've done and tried that haven't worked and a lot of frustration about it. I've started to work with people with long COVID and ME. Those were not on my initial list, but with long COVID, I was very hesitant because I didn't know what it was or what was going on. And last thing I wanted to do was say that this could be helpful when there was no evidence out there and I had never seen anyone. But there is starting to be some research showing that emotion-focused therapy and ISTDP can be really helpful. So I have started to see people with long COVID and ME and have been having some success with that as well.
Are you seeing a shift in the professional community in terms of accepting this sort of therapy and treatment?
Yeah, that's been the most amazing thing as someone who, went through his own process over 20 years ago and kind of, as I said, hid in the shadows with this. It's really been incredible to watch the change. In fact, right after this, I'm going to switch to another Zoom meeting and I'm training doctors here at our local hospital on this as part of a community of us that's been doing this work. So yes, I get calls from doctors a lot now. Not just for, training or teach me about this, but can you see my patients? Because, there's a growing recognition. Even in medical school now, they're starting to get some of it. There was no pain curriculum in medical school. And they're starting to have one now and starting to look to scientifically supported approaches. Back pain is not scientifically supported, or back surgery. The evidence shows that most people with back pain, only 20 to 30% of them get better. And most of them have long-term problems after. One of the biggest diagnoses now is failed back surgery syndrome. It just doesn't work in most cases. And our approaches have much higher success rates that research is really supporting.
So what do you think about the people out there that are maybe a bit resistant to this idea or reluctant to go into therapy because it's going to be a really painful thing to endure, but yet they're still struggling with their health? What do you think is happening there?
Yeah, that's a good question. Dealing with emotions is never easy. It is some of the hardest work that we'll ever do. ISTDP is an incredibly difficult approach. It's incredibly supportive of people, but it's different. And I do liken it to, some different therapies that people go to that they found helpful but don't cure them, which I used to do. Cognitive behavioral therapy, person-centered therapy. Those were my approaches prior to finding ISTDP. And they were helpful. But I liken them more to like a walk. Like walking is really good for everybody. great for your health, right? Everybody should go for a walk and walk a lot. And it's easy and it doesn't cause much harm. ISTDP is more like CrossFit, right? If you really want to change your body, going for a 20-minute walk every day is not going to do it. You got to get in the gym and put the more severe work in. And that's what I like in ISTDP, too. Like a really supportive CrossFit coach. Because the goal for us, we have this threshold that we're working at, right? This emotional capacity that people have for these difficult emotions. And most people with chronic pain, their emotional threshold is very low. And so what we want to do is increase the threshold gradually. And our therapy should get people to the most that they can tolerate, deal with, without going over, because then we'll have setbacks, without staying too low, because then we won't see progress. Just like good fitness, right? You wouldn't just take off and run a marathon after just walking 10 minutes a day. You would build up to it to your maximum capacity every day. And so that's the goal with ISTDP. So we do look to take people a little bit further every time without going too far over. And that's difficult work.
And I suspect one of the biggest barriers for people is even before this, because most of us think of our, mental health and our physical health, and those are two separate things. And if you're going through major physical health problems, addressing your mental health stuff is a nice to have. When I was really sick, I started going into therapy and counseling, but it wasn't to make myself get better. That wasn't my motivation. It was just to help me cope with the sickness and keep me going until I found my physical cure. So it's such a change in mindset and our understanding of what's happening to even get people to the place where they see this as a part of their path to getting better.
Yeah, my clients will say that all the time. People have been in therapy for 30 years and then see me and say, this was different. And why didn't I find this sooner? My answer is always the same. You find this when the time's right, and not everyone's ready for this at this point in their lives. And probably about 70 to 80% of my people get better, but 20 to 30%, it's not the right time for them, and we'll decide together that it's not. And one of the things I published a study on a group that I ran, so we were actually looking at data. And one of the things we do notice is that people get better, generally have a setback at some point. As things start to get more difficult, emotionally, these defenses get really activated and their symptoms will flare up or new things will happen. And that's the time, that's the make or break time. People who really believe in it and know that a setback is part of the progress will stick with it and work through it and get better. And people that aren't so sure about this will say, well, this is just bringing up all kinds of stuff. I'm already sick. Now I got to deal with all these emotions too. And then they might be the ones to decide this isn't the right time for them. People who get better in my study were the ones that believed in it so much at the start that they worked through the setbacks and were able to make a lot of progress after that.
Well, Doug, this is just incredible. My head explodes every time I have a conversation with someone like yourself. It's so amazing to have professionals out there who are aware of this and out there and available and helping people, because this is not the case just a very short time ago. So I really appreciate you taking the time today to walk us through this and to show us, the science behind it. This is real. This is helpful. And it is. And that message that it is coming into mainstream conventional practices is really encouraging to hear as well. So yeah, thank you so much for this.
You're welcome. Thank you for talking to me. I appreciate it.
Yeah, I'm curious from the viewers what questions you have. Love to see it. And what's your experience been with all of this? What's your take? And also want to send a shout out to channel member Yusuf David. Thank you so much, Yusuf, for the support and joining the channel. Sending big hugs to you. I really appreciate it. And for people watching, I know this is a lot to take in. If you're not already on my mailing list, I do send out a weekly newsletter that summarizes in bullet points kind of the key takeaways from the interviews if you're not able to capture them all. So there's a link for that in the video description as well. So yeah, thank you again, Doug. Thank you to those of you watching. Sending you massive hugs. I hope you enjoyed this video. I hope you got a lot out of it, and I hope to see you in this next one.